Good afternoon, good afternoon, good afternoon. Our cherished viewers. I've missed everybody. I've really missed everybody because last month I was under the weather and I couldn't make it. But this month and today, I'm here to be with you once again for us to talk about breast cancer. This month is Pink Month. October is celebrated globally because everybody have breast. Whether you're a man or you're a woman, you have breast. So it's a global issue and it's a national issue also. So in our own small way at PZ Casinos Ghana, will come your way this month to enlighten us a little bit and for us to also do a top up or additional learning of what we already know about breast cancer and who does it affect, who is at risk, the preventive measures, and even if you have what can be done for you, and if you're a survivor, what you can do so that you can live long. Then the stages also in breast cancer. So we are here to learn, to share ideas, to have fun, and at the end of the day, spread the word so that everybody will know that breast cancer is curable, is treatable, is preventable, and everybody is also at risk. Thank you. Today, we are saying that breast cancer, the cause is unknown. It's unknown because at the end of the day, we don't know what brings about breast cancer. We are saying that there are risk factors that brings about breast cancer. And also this year, we have a very nice theme that we chose. And that theme I like to share with everybody. So you can put it on your status, you can put it on your Facebook timeline, you can also use it as your reel. We are saying that no one should face breast cancer alone. Keeping hair in the picture. Reason being hair because women are the ones suffering. Women are the ones going through a whole lot. Women are the ones that are experiencing breast cancer more than men. We are also saying that all bodies have breast. Whether you're a man or you're a woman, you have breast. And so far as you have breast, the chances of you having breast cancer is high. And we are saying that the scope of the problem of breast cancer is globally 2.3 women are diagnosed with breast cancer. So in all, we are saying that every quarter we are expecting 68500 deaths. So out of the 2.3, this is the number of women who die. We're also saying in Ghana, yearly, 40,000 women are diagnosed with breast cancer. So when you take 10 women, you sample 10 women, you get 3 who are having breast cancer. Then combined with cervical cancer, we'll get 60%. So when you take 10 women, you get 6 women having breast cancer and cervical cancer. Then 70 of them will die in 5 years if they come in late. So everybody needs the awareness. So today we are telling you that early detection saves life. Then we're also saying that because the cause is unknown, there are factors which are associated or which increase the risk of breast cancer. The first one is either you're a male or you're a female, you have a history of breast condition such as breast cancer. So you've had breast cancer before, you've been treated, so possibility that it can come again is also high. If you're obese or you are too fat or you have too much estrogen usage, you use the estrogen too much. So nowadays there are oils, there are pills people are taking to enhance the breast, and those medication are estrogen based. Majority or 99.99% are estrogen based. Possibility that you use those creams, those pills, that you can get breast cancer is high. Then usage of tobacco and alcohol. So if you're a man, you're a woman, possibility that you are using tobacco or alcohol, you can get breast cancer. We're also saying that women who do not breastfeed, so you've delivered a bouncing baby girl or boy, and you're not breastfeeding because you feel when you breastfeed, your breast will sag. It's telling us that possibility that you can also breast cancer is high. Then those using hormonal replacement therapy, you can also get breast cancer. Those who have also had previous treatment on breast cancer, so either radiotherapy, possibility that you can get, or chemo, you can get breast cancer is high. Then those who abuse estrogen pills, so emergency contraceptive is supposed to be taken once in a year. If you know you are not safe, the best way is to have family planning done so that you can take care of yourself. You know you are safe every month. But when you abuse emergency pill every month, possibility that you can get breast cancer is high. Then we'll go to symptoms that shows that we have breast cancer. So I have a picture that I'll show to you. So the signs and symptoms. So we'll see from our diagram that appearance of lump. So we are seeing our lump in the breast. Then we'll see a nipple discharge. We'll feel presence of swelling in the breast. So that one, it doesn't move. It starts at one place and it's painless. It's not painful. Then you see redness in the breast or nipple. So you see a dark person, but you see the breast is red, the nipple is red, and the nipple is also and is discharging. Then we have skin changes. We have skin changes. We have skin changes. We have skin changes around the breast, under the breast also. So this is how the swollen lump nodules or nodes starts under the arm. So it starts under the armpit as a form of cyst under your armpit. Then it will get swollen. And because it's painless, you think it's nothing. Then from there, you see an ingrowing hair in it. Then you see your allergic rash. It will be all over your armpit. So we are telling everybody, when you see something like this, please don't squeeze it. Please don't do anything about it. Rather rush to the nearby hospital and show it to the nurse, midwife, or doctor. Then the necessary action will be taken. And if you're a man and you have a lymph node around your collarbone, please don't squeeze it. Don't apply hot compress. Don't go to the native doctor, then they will put they'll put knife in hot fire and say they are cutting it open because it's just accumulation of fluid. No, you're rather making your issue worse. So if you can see from my picture, it's not only about women, but it's also about men. It's also about men. So we'll see from our next picture that how the lymph nodes starts from the breast. So you see, this is a normal breast. When you look at the normal breast, indirectly, it has sagged a little bit. So that should tell you nature has its way of telling us something. Now, you see how puffy the next one is. Most of the lamps gives you a very beautiful shape, erected, standing breast. But when you look at a normal breast, it has sagged a little bit. So you don't need those enhancements. You don't need all those things because God created you naturally. That the breast, definitely, it will sag. And let's see where the lamp is, closer to the armpit. It's not, it's so close to the armpit. And when you look at the lamp, it looks like, oh, this one is nothing because it's painless. Then also we know the body changes color. So you see the color, the first picture, most women actually go through that. They go out to buy all sorts of medications. They will apply it. In the next 2 weeks, 1 week, it comes back again. They'll tell you, "Oh, because air doesn't pass through my breast, because I do hectic things. That's why I'm not getting air around it." And this time we are telling all women that when you get home, just release the breast. So you take the breast off the brazier, allow the breast to dangle, allow the breast to feel free, allow the breast to have enough air so that the breast can rest. We are also saying that sleeping at night with brazier is not, or a bra is not an advisable thing to do unless you're a nursing mother and you are breastfeeding your child exclusively. Pardon me, sorry. Our next picture, you see that they are dimpling at the side of the breast. So there's a dimple, the first one, then the second one, before the actual lump is under the breast. Then when you look at the nipple becomes inverted. It gets inwards. It gets inwards. And at the end of the day, you know that you had an erected nipple. What happened? Then the next one, you see, it has inverted nipple or retracted nipple, all right. Then the skin of the breast looks like an orange. It looks like an orange. If you have this breast, it's not normal. And the hair on the breast is ingrowing, it's not outside. So we shouldn't misinterpret those women who are hairy on their chest. Those women are not having cancer. Please. It wasn't a pleasant experience this week. A woman came that a friend told her because she has a lot of hair on her chest, she has cancer. Whilst at the end of the day, she has done her mammogram and everything, nothing showing she has cancer because she has hair on her chest and some just around the breast. Those are outward, they are not inward. Then we see the nipple discharges also. So there are different types of nipple discharge. We have the yellowish discharge, we have the bloody discharge, and then we have the whitish discharge. All this is telling us that the woman is suffering from breast cancer. Especially you look at the middle photo, there are sores on the breast. Then there's the first one also, there's color change on the breast. The breast is so whitish, so white. Even no matter how fair you are, I don't think your breast color should be like this. So let's pay attention to our breast because the breast is something that beautifies or is part of the beauty of the woman. At the same time, also, it feeds many nations. So we have to take good care of the breast. Then we'll go to the stages of breast cancer. We have stage 0 all the way to stage 4. So since we are actually celebrating October, which is Breast Cancer Awareness Month, we are saying that every woman below 40 years, every year you should have a breast scan done. Every woman above 40, you should have a mammogram done. So when you do this and you know that you are free, your survival rate is 100% because you've gone, you've done the test, you've done the self breast examination. Doctor says there are no lumps, there are no cancer cells, there are nothing in your breast. You are good to go. So your survival rate is 100%. Then the stage 1, you do your self breast examination, you realize there's a lump, small lump, which is not movable, which is painless, and you send it. You do your test, it shows that at the end of the day, there are cancer cells which are trying to grow. Biopsy is done, then it shows the results comes in that, oh, they are trying to go. It's not that they have grown, they are trying to go. Immediately they'll take it out, treatment is given, and you are good. Counseling is also will be done, education will be given to you, then you can have a normal life. Your survival rate is 98%. Then also, we are in stage 2. With stage 2, we are saying that the cancer is in the breast tissues. The tumor is less than 2 inches across the size. Cancer may spread to the axillary lymph nodes. So at the end of the day, we are saying that where the cancer cells is, it will definitely, it starts from the axillary. So the axillary is the armpit, and we are also saying that it can spread all the way to the breast. So that one, when it's detected early, so per the scan, per everything, and you know that, oh, I am, I know this is my problem. They've done the biopsy. You've seen what the problem is, because the cancer cells have not spread so much. It's just at a small place. We'll take that one out. We'll take care of you psychologically. We counsel you. We put you on treatment. We put you also on preventive measures by counseling. The survival rate is 88%. Then the third stage, the tumor is larger than 2 inches. So if you have a ruler, you can just look at 2 inches. It will give you a fair idea of how 2 inches looks like. Then across in size, cancer has spread to the axillary lymph nodes. Possible dimpling, then inflammation or skin color change. So I show the skin color, at the same time also I show the dimpling of the breast. At the same time also I show the skin color. So changes also on the breast. All these things you'll be experiencing it. Immediately you do your mammogram or your scan biopsy is taken and you adhere to treatment, your survival rate is 52. Then we'll go to the fourth stage. The fourth stage, that is one, cancer has spread beyond the breast to the other nearby areas of the body. So it has gone all the way to the lungs. It has traveled all the way to the liver. It can even go as far to the bone marrow, to the cervix. It can spread at so many places. By the time you realize your survival rate is 60%. So cancer is not a disease that we should joke with. When you joke with it, at the end of the day, you'll be found wanting, because when you look at women, previously the education was not sinking down. Previously, education was not sinking down. Education was not sinking down because people thought that when you have cancer, it's a death warrant for you. It's not true. Rather, when it's detected early, you can have a normal life. You can live. So when you go and you see your doctor, they do the labs for you, they do the scan, they do the mammogram, and they tell you that this is the problem. We can do this, that to help you. Please don't run away. We have lots of patients who have absconded and we've lost them. They are no more with us anymore. They've run away. They've gone to places. They've gone to places thinking those places will give them solution. But those places didn't give them solution. Rather, it makes their condition worse. There's something about breast cancer. Immediately it starts spreading. It doesn't stop. It spread, and by the time you realize you've lost your life. So when you see it early, at the end of the day, we can save your life. So we are telling everybody that breast cancer is not a death warrant. Rather, you can have a life, because now there are so many things which is being done for the women that It helps them to survive. Now we'll go to our early detection and prevention. We are saying that first, before 40 years, we can have a breast scan done. Then every month when you do your menses and you are done, the following week you can have self breast examination done also. Then also above 40 years, we can have a mammogram done. We can have a mammogram done. We are also saying that all these risk factors that we've set up, we've spoken about it, personal or family history. So if your grandmother or mommy has experienced breast cancer before, possibility that you can also experience. So there's a family line that is there. At the same time, also, if you're not having children, you can have. If your first child, you had it after 30 years, possibility that you can have it is high. If you've gone through radiotherapy before or radiation therapy before of the chest or the upper body, possibility that you can have it is high. If you have breast tissues density, possibility that you can have is high. When your diets are high in saturated fat or increase in age, you can possibly also have breast cancer. When you don't take care of yourself properly, by if you've delivered, you're supposed to breastfeed your child and not breastfeeding, you can have breast cancer. If you smoke, you can also have. And the preventive measures, what we can do to prevent breast cancer is one, we shouldn't, if you smoke, you should minimize the number of sticks that you smoke. We should also control our weight by exercising. By exercising, that is brisk walking, jogging, swimming, aerobics, dancing. At the end of the day, all these things will help you to also lose some weight. Then we should limit or avoid alcohol totally. We should breastfeed our children. Then we should avoid unnecessary exposure to radiation and be physically active. So, for instance, if you work, your work demands for you to sit a lot, immediately you sit for about 30 minutes. 30 minutes. Please just get up, walk around a little bit before you come back and sit down. Too much sitting is not good. Rather, we are saying that you sit a little bit, you walk a little bit, you move around, irrespective of the job that you are doing, whether you are a photographer, you are a journalist, you're a secretary, you're a banker, you're a lawyer, you're a doctor, you're a midwife, you're a nurse, you're a teacher, you should do more of the walking because it's a form of exercise. I'm coming to show some pictures, which at the end of the day, it's it's not a pleasant pictures to watch, and viewers' discretion is advised. Because at the end of the day, if you don't have that heart, please don't watch. Just don't watch. So our first picture is the effects of Madam A or Miss A, her breast, what happened to her. So I'll tell you a story about this woman. This woman, when she was diagnosed in Kolibu, she was only in stage one. She said it's a lie. She didn't believe. But as she saw, went to some herbal homes and some prayer camps to seek treatment. And when she came back, this is what she got. So she was treated palliatively. Palliative means we want to help you to ease your pain. So there are medications which will be given to you to ease your pain, for you to have some relief, because at the end of the day, the cancer cells itself has already spread already. So those medications that will give you to cushion you to make you feel comfortable before God will come and call you. So it's not something that at the end of the day we can give you which can treat you. No. Patients like this, we give them palliative treatment. So we give you comfort. We make you comfortable before you meet your maker. And the next one also, this lady sat home for a very long time. This one was through home visit, and we went there, we saw her. This is how her breast is. And she had some herbal concoction near her side, and she was actually applying it morning, afternoon, and evening. And this is how worse the breast looks like. This is how worse the breast looks. This lady, both of them are dead. May their soul rest in perfect peace. This one, the breast is actually maggoting. If you look at the picture very well, there are maggots coming out of it. At the same time, also the breast tissues are all out. When you look at this, that she had a very beautiful breast. All she needed was the right channel, the right path for her to take. And people around her also didn't help. That's why we are saying this year, our team, no woman should face breast cancer alone. That is all inclusive. We are all part. This is OPZ Castles Ghana. We are adding our quota. We believe you can survive. We believe you have another life. We believe that you can make it irrespective. So we are saying that early detection is the drum that we are drumming. We are drumming that early detection saves life. Early detection saves life. When we see it early, we, at the end of the day, we can survive. And we are also telling every man watching us, listening, share with somebody so that we can all save the breast, either a male breast or a female breast. There are myths about breast cancer. The myth is they say men do not experience breast cancer. It's not true at all. They're also saying that it's infectious. It's a lie. For instance, the picture we are watching, there is no way when you get close to it, she will infect you with the breast cancer. No, there is no cure. There is a cure. There are even preventive measures that you can put in place that at the end of the day you wouldn't experience. You can get breast cancer only when you have a family history. It's a lie. Everybody is at risk. Wearing a bra can cause breast cancer. It's a lie. Using underarm deodorant can cause breast cancer. It's not true. Keeping your phone or your cell phone in your bra can cause breast cancer. It's a lie. But it can cause a different cancer, but not breast cancer. It can cause the radiation emitted can cause cancer of the lungs or cancer of the skin, but not breast cancer. Then consuming too much sugar causes breast cancer. It's a lie. Breast cancer only happens in middle age and older women. It's not true at all. Breast cancer doesn't know whether you are old or you are young. Breast cancer doesn't know you are in your middle. So far as you're a man and you're a woman and you have breast, you can get breast cancer. Then when the treatment is over, you are completely done with breast cancer. It's a lie. The possibility that you can get breast cancer all over again is high. So the preventive measures, like I said, we should avoid the smoking, we should avoid alcohol, we should exercise, we should lessen our saturated fat, we should eat healthy diets, so less carbohydrates, more fruits, vegetables, and high fiber diets, and let's exercise more. Then also the treatment. One, a biopsy can be done to confirm. Then also mammogram can be also done to confirm. Then the surgery, both or one breast can be taken. Then the lump alone can also be taken. Then the drugs are chemo and radiotherapy. So the biopsy, a needle will be put at the side of the breast just to take a small fluid or the muscle in the breast so that they will send it to the pathology unit. Then at the end of the day, the labs will be run, the test will be done. Then after that, we can say either you have uh, breast cancer or not. So these are some of the um, things we can also go back and look at. For instance, we can reconstruct your breast for you after the surgery. So this is how the reconstruction is done. So gradually they pull the muscle around the chest to make you look presentable all over again. But the difference is the reconstructive one is slightly harder than the actual breast. Then also we have the types of surgery. The type of surgery one, we have the total mastectomy. Then we have the one that they take the lymph out of it. So somebody can have the second diagram done, but still it doesn't work. Then they have to send the person back to theater to have it done once again. We're also saying that treatment depends on the stages of the cancer. So medical procedures are done, medications, that is estrogen modulators are also given, and chemotherapy, then bone health, hormonal therapy, then all these things are done. Then also the surgery. So they can do the surgery for you that you can have a normal life also. We're also saying that tissue expansion or for when we are doing the reconstruction, we can insert a balloon under the skin and gradually expand it to stretch. Then we can reconstruct a very beautiful breast for you. So we are saying that we should think pink and think of Breast Cancer Awareness Month because there's hope for everybody. We are saying that there's hope for everybody. There's hope for everybody. So cancer of the breast is for both men and women. Cancer of the breast is cancer that affects men and women. It doesn't know whether you're in your middle age or you are old. It can affect you so far as you have breast. The bottom line is you have breast. The man has a breast, a woman has a breast. At the same time, also, if you have a family history, possibility that you can experience breast cancer is also there. We are saying that there are so many things you can do to save yourself. That is the first thing is every year, if you are below 40 years, please take your scan of the breast. Then also do your self breast examination every month when you do your menses. Please, the following week, just make sure that you do your self breast examination either by lying down or by standing in front of the mirror. You raise both arms, you bring your chest forward, you shake your breast a little bit for it to dangle and see if they are in symmetry, like they are all on the same line. So when you raise your head, your hands up, you should make sure that you look at both breast, left and right, left and right. Then you lean forward a little bit. You shake the breast a little bit. When you shake the breast, then you see if they are all in the same symmetry. Then after, you start palpating from the armpit all the way to the nipple. Then you squeeze. Then when you squeeze, you put a small tissue at the nipple and check if at the end of the day there's a discharge coming or not. We are also saying that you, as a woman, if you've gone through surgery and they've taken your breast before, you can have a life. You can have a reconstruction done and have a life and live and have that beautiful you walk and be bold and know that you are a survivor. To all women and all men who are survivors of breast cancer, with all our hearts for you at PZ Castles Ghana. We are so proud of you that you took the bold step to save your life because there are others who didn't listen and now we've lost them. We are saying that breast cancer can kill. We are saying that breast cancer is dangerous just like any other disease that you can find on this earth. But it's preventable, it's curable, and it's treatable. All you need to do is to get to a nearby hospital. If you can't even do your own self examination, go there. There are midwives there, there are nurses there, there are doctors there. When you tell them, they will actually do it for you. And if there's any problem, they'll make sure you do the necessary lab to allay your fears so that based on that, we'll know it's just an ordinary lamp. It's not a cancerous lamp. So at the end of the day, we just take the lamp and you can have your life. Maybe it's even nothing. It's just a fat tissue there that they can take it out so that you can have a life. So everybody watching me, don't get scared. Today, very soon, next week, October is ending. There are discounts which is being run at various facilities. Please get closer if you are less than 40 years and have your scan done. If you are above 40, get closer and have your mammogram also done. And also visit a clinic and have self breast examination also done. So that at the end of the day, you know that you are safe. Even if something is detected, it will be detected early and you save a life and save yourself. On this pink October, we say, Customs Ghana, we love you so much. We care so much about you, whether you're a man or you're a woman. We love you so much. That's why we are coming your way with this vital information because we know that you are important to us. And without you, the workforce in Ghana will come down. So we are saying that let's get tested, let's get examined, and let's do our own self breast examination. If you can't do and your husband is around, just forward this video to him and let him just look at what I did and he'll do the same thing for you. Before I leave, I'll put a picture on the screen so that you can look at how breast cancer or breast examination is being done for women. So we are also saying that just look at this picture. You can even capture it. You can go back on our screen and also make sure that you can forward it, or you can even tag a friend, tag your spouse, tag your husband. So our picture will be coming very soon. You see the picture. So that at the end of the day, you tag a friend, you tag your husband, and let him look at it. Maybe you can't do it all alone, but he can also help you to do the examination. So we'll leave the picture on for some time. You can even take a photo of it. You can even go back again and look at the recording. Just look at the recording and just show it. Because at the end of the day, you see the lady standing in front of the mirror. She's looking at her breast, making sure that her breast is in line. At the end of the day, the breast is in line. Whatever you do, the breast should be in line. One breast definitely is bigger than the other, but it shouldn't be so big. One shouldn't be so big than the other. They are supposed to be in line. Then you use 4 fingers. You start palpating from the armpit all the way in circular form, all the way to the breast nipple. Then you get a plain white cotton. Then you squeeze the nipple off the breast so that at the end of the day you see if the breast is coming with any discharge. Then if there is no discharge, I still feel the lamp, please go to your nearby clinic and seek assistance. On behalf of PZ Customs Ghana, I would like to say a very thank you to all our viewers and also Pink month ends on 31st of October. But after October, you can still visit any nearby clinic to have your breast examined. I'd like to say a very big thank you also to it's free. My producer is asking me. The examination of the breast is free. So you come and we'll examine the breast. We'll do it for you for free. But the scan and the mammogram comes with a cost. So it depends on the facility that you use. It comes with a cost. I'd like to say a very big thank you also to Ghana Registered Midwives Association for making me come and sit here and give this education. I'd like to also wish Sister Sabina a happy birthday. Today is her birthday. All we are asking for at PZ Customs Ghana that God should give you more life, more strength, and also add more wisdom to what you have. I'd like to say thank you to Tilified for making me look beautiful as always anytime I come on my set. I'd like to say thank you to Ishen. I'd like to say thank you to Seram because without the two of them, I wouldn't be here. We'll meet again next month to talk, to have fun, and to learn from each other. I'd like to say I love you and bye. Yeah.